Now Huckabee.
We're back with our doctors. I want to bring in Dr. Marcy Zwelling. She's been with us before. We always love having her. Dr. Zwelling, some of these innovations are not new to you. You've been doing a number of years in your practice, not taking insurance, but I want to specifically address when Obamacare requires people to have insurance, but what they do, they work directly with you or Dr. Nunemaker or Dr. Champy. Are they going to have double coverage in a situation like that? Are they still going to have to satisfy the government too?
That's an excellent question, Governor, and the answer is no. Doctors such as Dr. Nunemaker and Dr. Champy, and by the way, I want to congratulate them and their patients for this wonderful opportunity that they've assumed. No, we have a section in Obamacare, 1301, that's a detail, but it is in the law that patients will be able to apply what they pay for us to the actuarial of their premium. So that will actually be deducted. Now, we have to wait for the government to come up with the regulations, and you know that Obamacare is a little bit behind the 8 ball here. So we're waiting for that to be put in the regulations, but it will be there. It is in the law. Yes, sir, it is.
I want to ask each of you, and Dr. Zwelling, let me start with you on this one. The privacy issue. Why is it that you would be able to keep our records secret, but Obamacare wouldn't?
Because we don't bill insurance. We don't send in those horrific codes that really are about billing codes. They're not about what's clinically going on with the patient. They're about a coding system. They absolutely violate privacy. Let me give you an example. If a patient came to the office and had a question about how they could prevent hypertension, something that runs in their family, I would be able to discuss it with them at will. That it's already paid for in their retainer. I'd be able to follow up with them in a month to see if they understood what I said, if they had any other questions, as opposed to a doctor who works in the system, who would have to bill a code to get paid. That code would be hypertension, and that patient would be plagued with that diagnosis for the rest of their life. I would warn the patients in this country and every American that the IRS, the NSA, horrific what they've done to violate our privacy. But the HHS, the Health and Human Services Department, even worse. They have access to every record in this country. Every medical record, Governor. And every time we contribute to that by actually, their new system, they call them meaningful use. This is this computerized system where doctors put in boxes. They actually check off boxes. Yes, I did this. Yes, I did that. They get a bonus. They violate their patient's privacy to get a bonus. Well, on moral grounds, just as Dr. Champy said, I could not do that. I will not do that. My patient's records never leave my office.
We've only got a couple of minutes, so I've got to be very quick here with both Dr. Champy and Dr. Nunemaker. Dr. Champy, are your patients protected in the manner in which you provide medicine so that they don't have to give up a lot of things, whether it's their Social Security number or details about their health care and their medical conditions?
Well, they are now. Originally, I had tried to cooperate with the electronic medical record program that was part of the stimulus package. It was an absolute nightmare. I was working for the computer, not for the patient. And when I did this at the beginning of the year, I scrapped that. Everything is back to paper charts. I no longer ask for anyone's Social Security number. I don't want it. If someone was going to get my patient's records, they'd have to break into my office to do it at this point.
And Dr. Nunemaker, is it that you're actually seeing patients for longer periods of time? And, you know, I'm not asking you to reveal anything about personal income, but you're making house calls. I mean, I haven't heard of that since watching Marcus Welby on TV. So are you able to make as much money as you would have if you were in the government kind of controlled healthcare system?
Well, no, but my lifestyle and income is actually better. I can provide better patient care, but without the administrative costs and overhead, it's amazing. We actually statistically looked at it, 22% on average of a physician's time is administrative overhead, mostly insurance. If you take that 22% out, times all the physicians in the country, you've added 165,000 new doctors to the workforce. But we consider ourselves Marcus Welby with an iPhone. We do enjoy those house calls, and we want to bring back the high-touch feel of medicine. And I couldn't agree more with Dr. Gollinger that your privacy is very much not secure. HIPAA is actually a huge barrier that the health Insurance Portability and Accountability Act has no use whatsoever in this day and age. When it was written, the Spice Girls were at the top of the charts. It needs to be overhauled.
Well, I want to thank all of you. It has been an absolutely fascinating and informative conversation to find out that it doesn't have to be all one size fits all. Let Obamacare do it. Dr. Champy, Dr. Nunamaker, and Dr. Zwelling, all of you, thank you very, very much for being with us today and giving us a lot to think about. I hope they're listening in Washington. I hope they understand that there are better ways to give health care to American citizens than this incredible big government solution called Obamacare. Let's hope somebody will pay attention. I certainly did. Well, you know, the stars get all the fame, but they owe a lot to the harmonies of the talented singers who back them up. You've heard her voice in some of the biggest pop hits of all time. Darlene Love is with us next.